Okay, so here's our en bloc capsulectomy. And the shells get real dried out once they've been outside of the body, so they're gonna sound like they're crackled quite a bit. But these are saline implants, and you can see this is a very, very thin, millimeters thick is this capsule. So you can imagine how difficult this dissection is. But we're gonna cut this open. This implant looks pristine. There's really no mold in this implant, which is talked about a lot, people having mold in their implant. And in her situation, this is a perfectly good implant and a perfectly good en bloc capsulectomy it almost looks like snake skin. All right, this is the right side, the other side, same thing. We're gonna cut this one open. Interestingly enough on this one, I don't know if you can zoom in on this. You can see how this capsule has started to get tight and contract. And if you look right here, that implant, because the capsule is tight, it's actually folded the implant like this from the contracture. And what happens is the depth of that folding becomes a weak point for rupture. Now, I don't know if it was like that in situ or not, but it may have been as this dried out and got tight. But that's something that's important to know. Oh, I cut it open. With capsular contracture, we see that a lot where it causes folds in the implant, and those are potential weak points for rupture. So sometimes with the capsular contracture, look at that, I ruptured it. Oh, shoot. I got her camera wet. I'm gonna get myself wet. Try not to make too much of a mess here. Just gently take it out since I ruptured it, not try to squirt everybody. So there. Well, people, this is a good demonstration. People ask, what happens when it ruptures? Well, you can see here, there's a rupture in this implant, yet it's holding its form. It's only over time when you apply pressure to a little puncture like that it leaks. But what would happen is once the pressure releases and all that oozes, it would stay like this until eventually enough of it would slowly come out where they would notice their breast is deflated. But most of the time we get a micro rupture like this in an implant, that's what it looks like.